Good evening, bonsoir. As there's no simultaneous interpretation tonight, I will be speaking in both official languages. And this first session should be about 15-20 minutes max, so that we can actually break out to the 3 other rooms where you will be participating in the presentations by the speakers who already know who they are. Alors, mon nom est Daniel Normando. My name is Dan Normando. I have the privilege of being your facilitator over the next 2.5 days. And I do consider it as a privilege. This is an extremely important conversation for Canada and Canadians. And we're here tonight to begin this entire conference. Et évidemment, c'est une conférence pour élaborer un cadre fédéral relatif à la maladie de Lyme. Of course, this is a conference to develop a federal framework on Lyme disease. I have 6 quick messages before I introduce the tri-chairs and have them welcome you formally. First of all, the presentations that you'll be hearing tonight, the 3 by the speakers, the tri-chairs, as well as the other presentations by the speakers, will all be audio recorded. They will be available online. Can't tell you when, but as soon as they're produced, they will be available online unabridged. Alors, les présentations que vous entendrez ce soir seront enregistrées et elles seront disponibles en ligne dans les semaines à venir. Secondly, we're going to be inviting you to express yourself in the language of your choice. All facilitators in all rooms are fully and professionally bilingual. Alors, gênez-vous pas, exprimez-vous dans la langue officielle de votre choix. Dans chacune des salles, vous allez faire des présentations. Each speaker, of course, will have 5 minutes, and they will be cued by myself in this room and the 3 other facilitators in the other room, and of course with a view to providing everyone with up to 5 minutes to share their voice, experience, journey, story, however you want to use those 5 minutes. The fourth message I have with you is, of course, somebody was asking me about, well, how did we get to the order of the speakers? Half of it was scientific, and the other half was random. And that is, when we started planning for tonight, there were a certain number of people who had expressed an interest, and more names were added. So in the first instance, your names are all down alphabetically. Then it became random. So, but you all know who you are, the order that you have, and the facilitators and myself will be honoring that list and helping to cue you as well, those who are coming up, following each of the speakers to make this evening as efficient and as flowing as possible. And again, of course, we don't want to end too late beyond the time that we have on the agenda so that we can be in shape for first thing tomorrow morning, because we will be starting at 9. Alors essentiellement, on a alloué 5 minutes par présentateur. On va essayer entre les facilitateurs et moi-même d'être fidèles à ce temps-là, et tout ça pour qu'on puisse terminer à une heure convenable ce soir pour débuter demain matin, étant donné que la conférence redébute à 9 heures. Next quick message. You will see that there's an independent filmmaker in the room. And of course, there's a video feed that's going into the room next door for the overflow. Tonight's session's not very long, so, standing, we're not worried about you because it's just 15 minutes or so, and then we'll be deployed in all our respective rooms. Tomorrow, however, you might want to, grab a chair somewhere in the overflow room. It'll probably be more comfortable for you. But if someone does not wish to have their image recorded, please advise the cameraman directly in the course of the evening tonight and, of course, tomorrow. Alors, pour ceux et celles qui ne veulent pas se voir sur la vidéo qui sera faite, c'est un documentaire, allez rencontrer le cinéaste directement pour lui dire que vous ne voulez pas votre image inscrite ou enregistrée ce soir ou demain durant la conférence. And lastly, This is an extremely important conference. All of you have been talking about this. If it's going to be a productive, generative, and very positive event that's going to be building a framework that's going to be responsive to the needs of Canadians, there's a number of ground rules I'm going to be inviting you to follow. One is everything we're going to be doing over the next 2.5 days needs to be based on respect. I don't need to tell you this. We're all really invited to listen deeply for understanding, to strive to understand why, so that we can all evolve together towards the building of this framework. And I'm inviting you all to be hard on the issues but soft on the people. And this will give us an opportunity to be constructive, to be progressive, and to really hear deeply what people have to say so that we can learn from that, so that the future framework is able to be a step in the right direction, that is going to be an improvement on what we have today. And of course, this is about creating a shared purpose for what it is we're here to do, so that we can have a collective impact that's favorable, that it really improves things, and that makes the approach to Lyme disease better, informed by your experience, your journey, and the science that we're going to be hearing about over the next couple of days. Alors essentiellement, je vous invite à faire preuve de respect les uns entre les autres, de vraiment faire preuve d'écoute très active et profonde pour vraiment comprendre le pourquoi, et aussi pour être vraiment dur sur les questions, sur les enjeux, mais vraiment doux sur les gens, pour que ce soit une conférence qui soit axée sur les résultats et que ce soit nettement, au terme de la conférence mardi après-midi, une amélioration pour contribuer à un cadre fédéral qui puisse vraiment améliorer la façon dont la maladie est vraiment gérée. Alors, ceci dit, without further ado, let me introduce the tri-chairs who have prepared this conference, who've heard many voices, who've designed an agenda, a program that is here to really respond to the objectives of this conference, which is to contribute to the development of a federal framework on Lyme disease. And they are, and I will introduce them one at a time so they can come. I'll introduce them all, but they'll come in one at a time to express their remarks. There's Dr. Greg Taylor, the Chief Public Health Officer, Public Health Agency of Canada. Le Dr. Taylor, qui est l'administrateur en chef de la santé publique, Agence de la santé publique du Canada. We also will hear from Mr. Jim Wilson, the president of Canadian Lyme Disease Foundation. Mr. Wilson est le président de la Fondation canadienne de lutte contre la maladie de Lyme. Et en dernier lieu ce soir, il y aura aussi Dr. Daniel Gregson, who's the past president of the Association of Medical Microbiology and Infectious Disease Canada. Le Dr. Gregson est le président sortant de l'Association pour la microbiologie médicale et l'infectiologie Canada. Without further ado, please join me in welcoming Dr. Taylor and the tri-chairs.
Thanks, Dan. Good evening and welcome. I'm delighted to be here tonight to open this important public forum on Lyme disease. Je suis heureux d'être ici ce soir pour ouvrir cet important forum public sur la maladie de Lyme. I'm eager to hear from all of the people who will be speaking this evening, so I'll keep my remarks very short. First, however, I want to begin by sincerely thanking you for attending and sharing your personal experiences with all of us. The Conference Planning Committee and my fellow co-chairs, Jim, Dan, and have been working diligently on planning and organizing this conference for the last several months. Right from the start, our intention was to make the conference as open and inclusive as possible. Dès le début, nous voulions que la conférence soit aussi ouverte et inclusive que possible. So I'm thrilled that more than 700 people are registered for this event, attending either in person or virtually. As part of the act to develop a federal framework on Lyme disease, which became law in late 2014, the Minister of Health will bring a new federal framework on Lyme disease to Parliament based on your input. The goal of this important conference is to gather that input and to seek direction and guidance on improving our existing efforts in surveillance, education and awareness, treatment guidelines, and best practices. These are the pillars in our approach to preventing and reducing the risk of Lyme disease for all Canadians. Voilà les piliers de notre approche pour prévenir la maladie de Lyme et réduire le risque pour tous les Canadiens. In keeping with the spirit of the Act, engagement and consultation are essential to the framework's development. This evening's public forum is an opportunity for those most directly affected to share their personal experiences with Lyme disease. The stories we hear tonight will shape and influence the discussions we will have over the next 2 days. Tomorrow, a summary of this public forum will be presented at the conference as a means of integrating all that will be expressed this evening into the conference discussion to follow. It is important that the dialogue we begin tonight carry forward through the conference and into the broader development of a federal framework for action. There remain a number of unanswered questions about Lyme disease that require further research and analysis. Un certain nombre de questions sur la maladie de Lyme demeurent sans réponse. Des recherches et des analyses plus poussées s'avèrent nécessaires. Those speaking this evening will provide valuable insights that will help determine how those questions should be answered. This conference is only one step of a much broader process of consultation and collaboration. There have been opportunities to provide your views before the conference, and your input won't end with this conference. As the framework is developed, you will have a chance to continue to provide feedback. The ultimate goal is to build a framework for action that contributes to a better understanding of Lyme disease so that fewer Canadians suffer from its effects. I look forward to continuing this work with you, and once again, I want to thank you all for attending and sharing your experiences this evening. I hope you find this forum and the conference to follow informative and productive. J'espère que vous trouverez ces forums ainsi que la conférence qui suivra informatif et productif. Merci. Good night.
Ladies and gentlemen, Mr. Jim Wilson.
Good evening, everybody, and I want to thank everybody for coming. I know for a lot of you this has been a very big challenge considering your health, and also I want to thank those people who have gone through the rather arduous process of registering online and then logging in and coming at us from that direction. I know this has been challenging, but it is certainly going to be hopeful and worth it, I hope. Also, I want to give a big thank you to Elizabeth May and all of the members of Parliament and the Senate who unanimously sent this bill through the legal process and into law. That was a huge achievement, and as we can all see, this is now bearing some fruit, so we hope this is just the stepping stone. I know that a lot of you are tired already, so I'm not going to give a long talk. I'll be speaking again in the morning and again at the wind-up of the conference. It took 27 years for us to get here, since the formation of the very first Lyme disease group in Canada. So it's significant that we're here. It took too long, but here we are. So let's move along and get things underway. And please be respectful of the allotted time for each person's talk so that the evening can run smoothly. And I look forward to hearing from everybody's presentations. So we'll talk later. Thank you.
Mesdames et Messieurs, Dr. Daniel Gregson.
Well, thanks, Jim and Greg, for the talks you've given. And I'm here on behalf of the Association for Medical Microbiology and Infectious Diseases. I'd like to welcome you all to this important meeting we're having over the next few days. AMI Canada's members are really dedicated to ensuring Canadians are protected as much as possible from infections, and that we have the tools we need to appropriately diagnose and treat patients when they do get infected. Over the next 2 days, not tonight, over the next 2 days, you're going to hear the scientific evidence that's going to help guide Health Canada in forming policies around Lyme disease in Canada. But tonight is about public input, and we are here to listen. We'll hear your stories. Here's a little bit about my story. I graduated from medical school 33 years ago. And at that time, there were public forums being held throughout the nation because there was this disease of unknown etiology with no effective therapy and 100% mortality. I helped set forth the path of setting up networks of specialty clinics to guide us in collaborating on research and randomized controlled trials and having a coordinated response that has been so effective that the suffering, loss, and fears that occurred in the 80s and 90s is largely forgotten from the public's consciousness. And in fact, it's hard for me to recall what it was like during those years. So during those years, I cared for a lot of patients, and I'll just give you a couple examples. One of the first patients I saw was a young man, a young gay man, came into hospital with low platelets of unknown cause. We had no reason to know why he had low platelets. Finally figured out that it was probably related to this new disease called AIDS. Managed him with a splenectomy, discharged him from hospital better, and 6 months later I had to run a cardiac arrest on him in the emergency room for 2 hours unsuccessfully. He died. A few years later I had a patient who was a hemophiliac who I got to know very well. First met him when he had multiple infections in his joints, got him over that problem. Saw him in the middle of the night in the emergency room with meningitis, got him over that problem. And he subsequently died approximately 2 months after his wife gave birth. And probably the hardest one for me to talk about is a young patient I had, Elizabeth. She's 4 years old, a twin girl. She had a mother who had HIV obviously as well, transmitted, her infection was picked up, transmitted during pregnancy. And the mother was really racked with shame of having HIV and guilt from having transmitted this to her daughter. Took care of this patient for about 2 years. And the family had to move to Toronto, and I had to really sit down with this mom for 2 or 3 hours to convince her that, despite my ego, that actually the people in Toronto could take care of this patient just as well as I could. So at a meeting probably 2 years later, standing by a poster, one of my colleagues was presenting about a patient with a brain lesion. There's all these pictures and the x-rays, and lesions in the head, lesions in the lung, et cetera. Have a chat with him, and he said, "Dan, how are you doing?" I said, "Fine, how are you doing?" He said, "Fine." He said, "Nice poster." He said, "Oh yeah, that's your patient, Dan. It's Elizabeth." She didn't make it either. So the suffering and loss my colleagues and I experienced during these years was really horrific. And we heard people suffering, we saw people suffering, and we still hear and we still see. We see your suffering, we hear your suffering. And there are people who are famous for their contributions to HIV science. Really, you'll read about them in the papers. Luc Montagny is a Nobel Prize winner. David Ho was on the cover of Time magazine in 1996. And a colleague of mine was invested in the Medical Hall of Fame just last month for his work on AIDS. Both his discovery of 3TC, which is the backbone of therapy for many years, and his contribution to making sure patients worldwide received appropriate therapy. But all the progress we had in HIV care and all the progress we have in all clinical illnesses is really dependent upon patient participation. All that progress we had was due to patients participating in trials. So patients who participate in basic science studies and clinical trials, particularly randomized control trials, were really what helped us move forward to form treatments. So moving from what may or may not work to what works even better. And HIV therapy today is evaluated by how bad the toxicity is, not how well the patient does in terms of outcomes. So I'm going to close by saying, not only is your input needed tonight, your input is really required we really require patients' participation in ongoing, well-defined research studies to really help us move forward in making people feel better. Thanks for your attention, and best wishes for a great meeting.